On Monday, our country received some very promising news regarding a coronavirus vaccine that Pfizer is developing. The first results from phase 3, the final research phase on their vaccine, show it to be very effective in preventing COVID-19. That's great news. This should give us all great hope. It could be here as early as December, and we will be ready. We will be ready to get it out just as soon as we receive it. We've been told that it will come in batches. In the first several months, our priority will be to get it out to protect the most vulnerable and to protect our essential health workers. We'll then be able to move to the general population. At some point after that, we hope to achieve significant immunity in Ohio. But tonight, I want to talk to you about what we do until then. We are now at the most crucial phase of this pandemic. We're in the midst of our third wave in Ohio. In the spring, as the virus first surged, we shut things down. The Ohioans did what they had to do. We flattened the curve, and we were able to open back up. In the summer, we got hit again. The virus was heaviest in our urban areas, and so some of our mayors and our Ohio Department of Health issued mask orders in these hot spots. Mask wearing in those areas went up dramatically, and as a result, cases dropped dramatically. We're now seeing a third spike, but this time, things are much different. Now, we had been warned that when it got colder and drier and people were indoors more, the virus would rise up again. It certainly has. This surge is much more intense, widespread, and dangerous. As of today, every single one of our 88 counties has a high rate of virus spread. And areas of our state that were previously untouched, our rural areas, are being hit especially hard. Let's look at the numbers. At the end of September, we were averaging under 1,000 cases per day. Today, we reported our second highest number of cases at nearly 5,900 cases. While yesterday, we reached the highest number yet of over 6,500 cases. Now, I know that some people say that the only reason we're seeing more cases is because we're doing more testing. Well, we are doing more testing, and we're very happy about it. But the fact is that while testing has not even doubled, cases have gone up almost 4 times. Let's talk about our fellow Ohioans who are in the hospital right now with COVID-19. During the spring and summer virus surges, the most COVID patients we ever had in the hospital at one time was a little over 1,100. Last week, we were at almost 2,000 COVID patients in our hospitals. And today, 1 week later, we are now approaching 3,000. We now also have a record number of patients in our intensive care units. A month ago, 240 patients with COVID were in the ICU receiving critical care. Tonight, more than 700 of our fellow Ohioans are in the ICU. We've learned throughout this pandemic that what happens today sometimes won't reveal its full impact for weeks. This is certainly true of hospitalizations, and sadly, it's also true of deaths, leaving us with the stark reality that we simply won't know the ultimate fate of individuals who are diagnosed today with COVID for weeks or even months. Now, despite great work by our medical personnel, improved treatments for COVID, too many of our fellow citizens are still dying. In the first week of October, 86 Ohioans died from COVID-19. With many more Ohioans testing positive for COVID today, we know that number will surely grow. And It already has. During the first week of November, 104 Ohioans died. 104 mothers, fathers, brothers, sisters, sons, and daughters. 104 families left to mourn and grieve a loved one. To those families, please know that Ohio grieves with you. Now let's talk about our nurses, our doctors, and all those who care for COVID-19 patients. God bless them. Our hospitals are functioning right now, as if they were at the peak of the flu season in January. But unlike the flu, when hospital personnel know that cases will begin to drop and come to an end in the late winter and early spring, these new COVID cases are not trending down, and it's taking an enormous human toll on our healthcare workers. In the spring, we wanted to be sure we had enough personal protection equipment. That's what we worried about. We worried about ventilators, hospital space. Today, the question is whether or not we have enough people. Our healthcare workers are, quite frankly, exhausted. They've been running a marathon for 9 straight months. And with this new wave and the onset of flu season, it's like they're starting the race all over again. If we don't change this, we will not be able to provide appropriate care for all the Ohioans who need it. All the Ohioans who need it for COVID, and for all those Ohioans who require other emergency care, things such as accidents and strokes and heart attacks. Hospitals will again be forced to postpone important but less urgent care. Make no mistake, if nothing changes, this all could happen in just a few short weeks. Today, I was asked by our